Welcome back to another episode of the Parisi Podcast. You are not only gifted with one Casey this episode, but two Caseys. Carey is on the other side of the screen. For those watching, for those listening, just enjoy with the headphones. Carey, how you doing?
I'm doing great. I love that there's two Caseys in the building.
I know. If one is good, more is better. But you're the guest of honor today. I appreciate you taking time on a lovely Friday afternoon in bitter cold Vermont to talk shop. For those that didn't read the show notes, you'll get a little intro on who and what Casey is. But Casey, I think, when did we cross paths? You were in college, UVM undergrad.
I think I was a sophomore in college, and you actually gave me the whole Parisi coaching. You walked me through the certification and certified me.
Yeah, and then, I think you started maybe with Joe as well and Andrew. Was it like the three of you? It was a long time ago. It was a long time.
But yeah, I learned a lot about running for sprinting form, a lot about change of direction, things that I still use today.
But now you do it from the medical side. Would you say medical side? Do you think physical therapy is more medical?
Yes. Like, I would call myself like a healthcare provider. It's medicine, exercise is medicine.
Yes,
so
yes.
Definitely would consider it medical, but maybe in a different way than other people.
We'll get to that. That's one of the specific questions that I sent you, because you are the person, you are in the clinic. When I refer my clients to you, you put the physical in physical therapy. We will talk about that. But Carey, I'd start the pod with everyone asking who you are, what you do, how you got into it. Give us a little background.
So as you guys know, I'm Carey. I'm a doctor of physical therapy, and I work at Burlington Physical Therapy, which is a sports rehab clinic in Vermont. And we really focus on longevity and getting people from a point of injury, but also like through that performance spectrum. So not just returning them after the injury, but trying to like guide them through the whole continuum of rehab to training. So I got here, let's say, when I was younger, I played a lot of sports, and I started like working out a lot more and just realized how important exercise was for like my mental and physical health, and also how much it improved my performance in whatever athletic endeavor I was doing. So I was like, it would be a good idea to start studying exercise as medicine. So I went into exercise and movement science, and then I shadowed a few physical therapists who were more in the sports realm. And I was like, this is awesome. This is so cool. These people are like using exercise as medicine and prescribing exercise, and it's healing these athletes. And I just thought that was a really cool concept, and I decided to run with it.
I know this was like the second question. We can probably start here, but this is something that I know, like, how I interpret it. So please tell me if my interpretation is wrong. But when I like refer people to you, or when I see you guys' videos, like, you have a squat rack, you have people like right before this, I think I saw you had people like someone doing like ACL reconstruction, like post-op therapy. And it isn't what people, I think, assume physical therapy is going to be. Like, it is, like I said, the physical and physical therapy. And maybe it seems supernatural for you because you shadowed in that realm. You've seen people, like you're saying, like exercise as medicine, and it's got a prescription, and it's helping people become better. But I think a lot of times people think physical therapy, they think TheraBands and stim machines and ultrasound. And I'm not saying that stuff is bad, but it seems like you all practice with a very physical modality first. Can you talk a little bit about that, and maybe like what is it like when you explain to a client, okay, come on over to the squat rack, and they're like, no, my knee hurts, and you're like, I know, come to the squat rack.
Yeah. So I think totally. I think a lot of PT clinics, especially like bigger clinics, you'll see like those modalities, ultrasound, heat, ice, like, let's get you using the TheraBands. I think we're starting to see a shift in that. There are more like performance-based physical therapists. And with that shift, I think people are recognizing that, well, there's a lot of new research out too, that you have to like load a tendon or muscle to 80% of their 1 rep max. There's all this like blood flow restriction research now. Have you heard of blood flow restriction training?
For sure.
Yeah. So with that, it's like we're pushing people towards their 1 rep max metabolically instead of mechanically. So with all that research, we know we need to like load certain structures to a certain intensity in order to get the adaptation. We need to stress the area. So I think in these other clinics where TheraBands and, ice and all these other things, they can definitely work for those like acute patients where you just need to get them out of pain. But as we want to adapt the tissue and improve like the tissue healing, we do need to get these athletes squatting, lunging, doing heavy lifting in order to like truly make an adaptation and make whatever area was weak a lot stronger and more resilient. Like I think a lot of our goals here is not just to, again, get someone back to where they were. We want them to be better than where they were, because where they were got them in here. So we want them to really like push the boundaries. And like there's obviously this trend of being physically robust, like having body resiliency. So I think that's also kind of an important factor. So we use a lot of like the regular gym equipment to try and get those adaptations. And, you need heavy weights in order to get the adaptation stimulus.
Yeah. And I always, because I always think it's interesting, right? Like as a personal trainer, and I, like we were just talking before we clicked record, like I always tell people, like I don't do meal plans. I don't do, like, if you're in pain, we skip that part, right? Like, okay, your knee hurts, like we're just going to train upper body today. But when someone comes in and I'll say like, and I've had more of this now where I'll say like, have you ever, are you seeing any like medical practitioners? Have you ever been like, have you ever had any injuries, whatever? And people will be like, or have you ever worked with a trainer? People will say like, I've worked with a physical therapist who put me through a training program. And I'm always like, where? Like, because I feel like it's still relatively the idea of like physical therapy is still, I feel in the industry, maybe it's just a Vermont thing. Like we're in Northern Vermont. It's not the most densely populated area. There's a lot of elderly people who probably see your pretty traditional outpatient PT practices. But do you guys like when someone comes in, like, do they know like, hey, here's the squat rack. Like we're going to get into it. I'm sure you guys have that reputation at this point, but for you as someone like, cause you've been a PT for, it's been inside of 10 years still, right?
Yeah. 6 years. Yeah.
Yeah. So was it like, you obviously probably knew this was the kind of practice you wanted to go into, but is it in the industry? Is this performance PT? Is this still considered a new thing?
So I think that's a good question. So I think a big part of it is that insurance has dictated how PTs treat. Insurance is just looking for, did the pain go away and are they back to function? Where like how I want to treat is, yeah, they're back to function, but now they're like stronger, they're performing better. We're so far past that like initial phase of rehab that like insurance is looking at and is like, okay, we're going to stop paying you when you get here. So we actually don't accept insurance, or we're considered out of network providers. So we don't directly accept insurance. So I think insurance a lot of times dictates the care, which is why a lot of people might not get what they would get if they come to us. Is that answering your question?
It does. No, it totally, I mean, that could be a whole episode talking about the pros and cons of medical insurance and health. But we don't need to bark up that tree today. But I do think that, I think you described it perfectly where you said like, you try to get people back to into performance, not just to where they were, because where they were got them to the pain reaction. And how you described it, like insurance wants to see them get back to functional, whereas you want to see them improve, adapt, grow, whatever word you want to use from that baseline of whatever it might be. I always find it fascinating and I love it. Don't get me wrong. Like I tell people all the time, physical problems need physical solutions. Like I don't, no offense to the stretches and things like that, but if you're telling me your foot hurts when you're in mile 17 of marathon training, like, I don't know, like, I don't think a TheraBand is going to make a big difference at that point, like something else, like you're saying, like the tissue and the load, something is not adding up there. You should go see someone who can assess that.
Yeah. And I think that's the other thing. It's like what we do needs needs to match the demands of like the sport. We're trying to improve the capacity of a tissue to match whatever the demands of life is. So if someone's like a big runner, mountain biker, weightlifter, or whatever, where their sport requires a ton more loading than what a therapist is, we need to like figure out a stimulus that matches those demands. But to your question, we do get some people that are come in and definitely don't expect to be worked the way that they are here. And some people leave very sweaty and very confused, to not know, thinking that maybe this wasn't, maybe they leave thinking that this was like an extremely hard exercise session, and they're pretty confused. So I think like educating them on, tissue adaptation principles and all of that is helpful. But usually when we see those people, it's awesome because they end up joining a gym, going to a personal trainer, and it's really cool to see, someone grow in that way where they all of a sudden really appreciate what exercise has to offer.
Yeah. I mean, I wholeheartedly agree. And that's why a lot of times when I refer people, I'm like, well, I tell them, like we had a mutual client come back and forth between us. And I told them, I was like, hey, like Casey lifts, like you're going to know really quickly, like it's not going to be your traditional, like what you may paint a picture of physical therapy being. Like it's going to be very hands-on, and not only will you be with a barbell, but just know that your physical therapist lifts and you're going to be in good hands there. But one thing that stood out, clean segue here, Casey, segue. When you did assess that individual, was the use of technology. You sent me this whole like paper, like this readout, right? And that was part of, I was like, wow, this is a pod episode in itself. That's totally how we're here. But can you talk about like what that assessment battery protocol testing was, how you've used it, and just give us, and we'll probably have some more questions there, but like, just kind of give me the overview on like what that was, how you guys use it, and why it's so badass.
Yeah, so we use, my favorite piece of technology, the one that I sent you, which was called the Run Easy. So basically, it's an AI-powered wearable that has these sensors that we put around your hips. So it's a wearable, the sensors around the hips. And basically, this allows us to have a 3D biomechanical assessment. So we can figure out how much force development is this person producing? What's their like eccentric braking force? We can even, it's called the Run Easy. We can get people on a treadmill, see symmetry, cadence. Like it gives us all these metrics that just like better our treatment and allow us to measure progress over time. But what's really cool, what I love about the Run Easy is, especially for runners, so that's like more specific to runners, we can get like a running quality score that people tend to just do best when they have a number and see it, and that they can be like, okay, no, I want to get to here by my marathon time. And we can also say like, you're at 70%, you need to be at 80% if we want to guarantee that you're not going to get injured taking on this extra volume as you train for your marathon. With that patient, less about running, we did a jump test. So we use the Run Easy for jump testing as well. So like I said, we can look at force development, we can look at force absorption, elasticity of tendons that way, and stiffness. We can look at reactive strength index, but then also we use the VALD force index, which is also another way to measure force, ground reaction forces, and things like that. And that really helps us figure out like, okay, do we need to work on this phase of rehab, or are they in this phase? Like you get someone stronger, you get someone more mobile. But I think this new technology allows us to be like, okay, what does their power look like? And maybe when you assess them with the naked eye and using like a hop test where you might time them and look for symmetry, but then you get them on a vault or use the Run Easy testing, you can then see like, okay, they look really good with the naked eye test, but when you take them on there, it's like they're actually breaking down in this phase. So we really need to target our treatment to like eccentric braking force, or maybe they one leg needs this versus the other leg. So it's really cool. It really helps the treatment, but also just gives people more data and shows people like why they're in here. Why are they in here longer than someone who goes to just like your general outpatient clinic? Like maybe that's because we're working on those performance metrics and like those key performance metrics instead of just like a subjective data, like your pain is gone and, you know, maybe an objective strength test. In that way, this gives us like a little bit more insight for those higher level athletes, but also for all athletes.
Yeah. How often do you retest? Just curious. Like now let's get into the weeds a little bit.
Yeah, so we do something called a membership, which is basically people will come in monthly. And usually with like a monthly membership, we might retest every month. The hop testing takes like 3 minutes. If we were to do like strength tests or like a running test, that could take like 5 to 10. So it's like a quick test. You know, we don't have to do like the whole battery. Maybe it's just like 2 of the tests. But we'll usually do the retest every 4 to 8 weeks. If it's an ACL patient, it might be a little sooner. Yeah, so we will retest frequently with runners. I would say with the actual like running tests, I'll do usually every like 3 months to give people enough time to train when we're looking at like running quality, because it usually takes 3 months for that to change.
That's really cool. And I didn't know that the Run Easy was AI powered. I think that's because AI has obviously been a hot topic in this industry, like everything else. But I think it's really cool that, you know, it is being used in a I'm pro AI first of all, but I think it's really cool to see these assessments because on the performance side, like VALD and VLAD or whatever output, like all these different like units, like we always gather the data and it seems like it's almost very reactive as far as like, oh, you jumped this high. Okay, cool. Now you jump this high. Cool. The training works. But at least from a personal trainer or performance coach side, it's very rarely do we do a test that proactively shows us point A, if that makes sense. It's like where the program should start. And it's cool to see from your performance side, like if you see a deficit, if you see an asymmetry, if you see, and I don't know what other stuff, maybe you can share an example of like how it might guide a program or a treatment practice if you see like deficits, asymmetries, or if there's some other like quantifiable joint range of motion thing that it shows. I have no idea. As far or form mechanics, I don't see. That's the thing. I obviously don't know. I'm kind of like wondering now if I can come in and do a Run Easy at some point.
You would love it because you've been running a lot more lately.
I'm not a runner. I don't want to say I'm a runner, but I do run. But I have no idea what my running form looks like. I tell people I'm very lucky that I could squat double my body weight before I ran, and I think that has probably helped me more than anything else. But what else does it show? Like anything else? Am I missing something other than like shows like a deficit and asymmetry? Does it show like joint angles or anything like that?
So no. So what we'll usually do for like a running assessment or just like general movement assessment is we'll take a video on OnForm, which is the app, where you can put like different angles on shoulder, hip. So I'll do like a sagittal plane, different planes of motion, and look at the video analysis while the Run Easy is like collecting the other data. And then the Run Easy data for running specifically, it actually shows you dynamic stability, which is really cool. Are you losing energy in the lateral plane as you're running sagittally? Are you able to move straight forward, which a lot of people do lose quite a bit of energy just with their body sway, lack of like hip stability, things like that. And then it'll also show you impact loading and impact magnitude, impact duration and impact magnitude. Impact magnitude is how much force with each step, how much force is your body actually taking in. And we want low amounts of force. And then it'll also show you impact duration, which is basically how much force or is the force getting dispersed through like the ankle, knee, and hip? Or does it just stop at the ankle? We want long amounts of duration because that tells us that you're able to disperse the force more evenly through each joint. So it's really cool. It can tell you that because then that can really guide your training. Like maybe you don't have a dynamic stability issue, but we need to work on plyometrics. Maybe your impact duration is really short, so you're getting shin splints, and we need to work on like you getting the force into your glutes and more hips. So it definitely guides the training a ton. And I will say with just the video analysis, I could see like, okay, you have hip drop, like, yeah, lack of stability, but it's so much more info and just so better treatment plans after having this. It's really like changed the way I practice.
That's really cool. I am very intrigued by that. Would love to experience it. I will send a follow-up email after the pod. I'll send a follow-up email. That's super cool. I didn't know, because I obviously, like, you sent the sheet, and it was a sheet. It was like a full, I think, like front and back. I'm looking at it. Yeah, you're like, here's all the information. I'm like, oh my God, like, like, this is great because it makes my life a lot easier. But I am like looking at all this stuff and I'm like, I don't even know half of it means, like, and that's maybe the next question is, so from you, like from your standpoint, right? Like you take all this information, gathers maybe more than you need. Like and this is just kind of maybe your general treatment philosophy, like, and I know all of it depends, right? I know that's the big answer. Like, what is the person saying their experience? What are you seeing? And then what is the data, right? It's a three-headed monster of inputs. But how do you know what matters and what doesn't? Like, what's a front burner? What's a back burner? How do you kind of decipher when you get this much information, what really is usable in the moment? Or maybe what is just like, okay, look, that's cool. We know this, but like, we'll put it over here. We'll shelf it for now. How do you kind of decipher that?
So what I look at is what's the weakest link? What's the worst score? And does that correlate with your pain or dysfunction? And typically it does. And it's cool with the Run Easy, not with the Voldex, but with the Run Easy, it'll actually show you like what is the weakest link. And then that's what you kind of target in your training program. And then hopefully you see that improve. So that's usually where I start is, okay, this person has a major deficit here. So I'm going to treat that and take into account what they're saying, of course, but usually they are related. Where it can become a little more complicated is like with athletes who are just here for performance and want to improve something that physical therapists can help them with. Maybe it's like a muscle activation or something like that, but they don't really know why they're here. They're just here for longevity, where you're like, okay, we need to look at all these metrics, and then you're not having any issues and your running form looks great, you're strong, you're powerful, like what do we work on? And so it's finding like what is that weakest link, what can make them even better.
Cool. Yeah. That's awesome. It's a little nugget that I didn't think we'd get into. I like it. This like I said to Bill Parisi, I said we're just going to do the pod. I'm going to talk to all my friends, and then like I told you, I said I have like a couple questions. I'm sure we will unearth some other things through conversation. That's pretty nifty. So the other thing, and I'm kind of fascinated by this. So this is a very selfish question, but I'm the host of the pod, so I get to ask selfish questions. Is the idea of pain, the idea of like, I feel like we don't know anything as like a society about pain, like what pain is supposed to be. We know it's uncomfortable. We don't like pain, but I feel like from a lot of standpoint too, like I feel like pain is very misunderstood. I don't really know other than that statement, like where I could go with that. I just think it's a misunderstood feedback marker. What is your take? This is a very broad question, so take it however you would like to. What is your take / opinion on pain as someone who works with people who might be in acute to chronic pain? And you're obviously like trying to help them navigate that, but like, what's kind of your opinion and take and experience with it?
Yeah. So I guess my take is that pain is just information. Our body can only give us so many different ways to tell us to protect something. So pain is a sensation, just information. And then it doesn't always correlate with tissue damage, which I think that's the most common misconception, is that pain doesn't equal tissue damage. It could just mean, your form's wrong. Like maybe your knee is irritating you because you go into so much knee valgus, and so your body's giving you pain. But it can also be overprotective and be malprotective in a way where your pain is actually limiting you. So I think a lot of it is finding, where is the pain coming from, which PTs do. It's the same thing with tightness. I also like to put like tightness and pain together.
Yeah.
Be like, I'm really tight, I'm going to stretch. And it's our goal, like as a PT, to figure out, is the tightness the tightness is just a sensation from your brain? Is it because of it's a lack of mobility, length, strength, or control? So I think that's also kind of what I think about, like as a PT, what I do is like figuring out what is causing that, because you're feeling tightness and that to you means stretch, but it might not be that the tightness is because it's a length issue and it's actually like a motor control issue. So pain's kind of similar, figuring out, is this actually tissue damage or is your body overprotecting you? And then I like to go off of, depending on the injury, I'll just give an example, like tendons. I like to kind of go off like a traffic signal, yellow, or yellow, red. Or I'll give like metrics, like if you're at a 3 out of 10, you can still work out, the tendon will be fine. So I think giving people the okay that you can like work through this pain depending on what the injury is. Not all injuries you will want to work through the pain, but understanding the injury and understanding that like some pain is definitely okay to work through. And sometimes we'll continue to work through it, and that pain usually does get better. So you do, with a lot of injuries, you do have to work through pain. So really discussing that component, but then also discussing that pain is, there's context for pain. Like there is a study on demolition derby drivers that get into these like crazy collisions, high impact, and a lot of them don't experience whiplash syndrome or like chronic neck pain. But you would think, that's their sport. They should be, they're getting this fast like neck stretch, so they should definitely be experiencing whiplash injuries, because most people who get in a car accident at similar velocities or less will experience whiplash injuries or chronic neck pain. And these demolition derby drivers, most of them don't get it. And a lot of that is because it's a sport. They're excited about it. They expect the crash. So they don't get pain because their nervous system is like prepared for it. And their nervous system is like, okay with the crash. And so I think it's like very context specific. Like if someone is doing a sport and they're not stressed, their nutrition's good, their sleep's good, everything's good, their cup's like half full and it's not overflowing, they're a lot less likely to experience pain. And so true with so many injuries, but specifically tendons. Like someone who comes in with a tendon injury and they don't sleep the last 2 nights and their nutrition was bad, like their tendons 100% going to flare up. And not because they did anything wrong, and not because their rehab is going poorly or their, X, Y, and Z. It's usually just like more stress.
Yeah. That was a really good answer.
Yeah.
I have nothing to add. I just really like that. Yeah. No, because I just, I feel like in the line of performance or general health, fitness, whatever, like pain is obviously like probably detriment number 1 or 1B. If someone's going to fall off the routine, so to speak, or if someone's going to miss a training session, it's a pain point or something. Hey, so-and-so, I was shoveling and my back flared up, or I was playing basketball and whatever, right? Like it could be like actual trauma, like I rolled my ankle, or it could just be like, I tell people, like, if you're over 30, sometimes your mattress at night tries to assault you and you wake up in the morning and you have no idea why, but it's just an over 30 thing. You just wake up and everything hurts. And that just comes up, right? But I never have an answer. Like I just tell people, I'm like, okay, like your knee hurts right now. I'm thanks for letting me know. Like I always I don't want to say I feel like an a-hole, but I'm pretty dismissive about it, because I can just cut that. I have the luxury. I'm not here to fix anything, right? Like I'm here to just work around it. So if you tell me your knee hurts, we just, like I said earlier, like we just switch it to upper body stuff. Like that's totally cool, so.
And like you're saying, sorry.
No, you're good. Keep going.
Oh, I was saying that, like you're saying, and we know most movement is good, endorphins, dopamine, so likely that pain's going to reduce in some way, or you're not going to think about it because you're now doing upper body. Yeah. So I think kind of doing that is really important, not to minimize the pain, but also to be able to work around it. People usually can find a way to move. And I think that's also part of my job is, okay, you can't do all these things, but we can slap the BFR on you and you can have a great workout with that. Like we'll figure out it, because it's so important for an athlete's mental health is to continue to be able to move.
Yeah, I feel like okay. So if you're down for a part two, in the future, I'm gonna roll into Burlington Physical Therapy. We're gonna go live from the couch or whatever you're sitting on now, and we're gonna talk modalities. And you're gonna explain modalities to me like I'm 7, and it's gonna be amazing.
Oh, okay. That would be all. We'll put you on the flow restriction training. We'll do all the fun stuff.
Well, when you say BFR, like I know BFR because it can be awesome for hypertrophy and just like the meathead inside of me is like, hell yeah, I do BFR. Like I've got the cuffs and like I use them for curls, right? Like you can get like pretty cheap BFR cuffs. Like they're not the most, especially for like solo use, right? But you use them on like the rehab pain performance scale. Like I think of them as like just a sick tool to get a sick pump on arm day, right? So it's like I would be really interested to talk to you about like the modalities, how you use them, how you like you're talking about with the BFR stuff to like challenge people metabolically. Like that maybe if you're down for it, that'll be part 2.
Oh, I would love that. There's also just for you, there's great research on the BFR helping to increase VO2 max, which is really interesting.
Yeah, I will. That might be happening. We do research reviews every month. I'll have to check into that.
Yeah, check that. I'll send you some studies.
Please. Yeah. Cool. I like to geek out. So this was a good geek out sesh. Casey, Carey, I appreciate you making time, joining me for the pod. We will do a part 2. And I'm going to come in. I'm going to do one of those run easies. Yeah,
we're going to get you assessed. Maybe that'll be in the part 2. We assess you. We show the viewers.
I got some really cool things that I'm personally doing in 2026. So I will definitely be, I'll be coming in soon for sure. Appreciate you making time.
Yeah, thank you so much.